Hello, everyone, and welcome to the Health Boardroom. I'm Ron, and I'm glad you're here today. This is where we pull back the curtain on the business and practice of healthcare. What's changing, why it's changing, and what it means for the people who keep the system running. Today, we are talking about something that touches all of us: how US healthcare has evolved since the COVID 19 pandemic. From chaos of 2020 to where we stand now with new Medicare and Medicaid rules, new technologies, and new expectations, the system has gone through one of the biggest transformations in its history. If you rewind to early 2020, the healthcare world was in a crisis mode. Hospitals were overflowing, supply chains were snapping, and telehealth suddenly became one of only the safe option to see a doctor. Overnight, everything we thought we knew about access and delivery had to be re-engineered. But what's interesting is how that shock forced innovation. The Centers for Medicare and Medicaid Services loosened regulations on telehealth reimbursement almost immediately. Providers who had never billed a virtual visit in their lives suddenly could, and patients who once preferred in person care started to realize that online visits weren't just convenient, they actually worked. And once people experienced that level of access, they didn't want to give it up. That was the first big shift. Healthcare had to meet the patients where they were, literally at their home. Now let's talk about the second big shift: the data and digital transformation. As the pandemic dragged on, every hospital, every clinic, every public health agency started leaning heavily on data. We learned just how valuable real time information could be. Tracking infection rates, predicting bed shortages, and even anticipating supply needs. Artificial intelligence and analytics went from research projects to frontline tools. Fast forward a few years, and those systems didn't go away. They have become the backbone of modern care delivery. We now have predictive models that can identify patients at a risk for readmission, tools that help clinicians spot subtle changes in vital signs, and systems that keep payers, providers, and patients more connected than ever. But all that technology raised a big question: who owns the data? The patients, providers, or big tech companies? Regulators have been wrestling with that ever since, and the conversation isn't over yet. Let's shift gears and talk about policy because the last few years have been huge for Medicare and Medicaid. During the pandemic, Medicare expanded coverage for telehealth on an emergency basis. But after seeing how effective it was, especially for the rural and elderly patients, Congress and CMS decided to keep many of those changes. As of 2024, telehealth for behavioral health, primary care, and chronic disease management is now part of regular Medicare coverage. Medicaid programs in many states followed suit, experimenting with hybrid models that combine virtual and in person care. The message from the government was clear: digital health isn't novelty anymore, it's part of the standard of care. And we've also seen a continued push towards value based care, right? Paying for outcomes instead of volume. That idea existed even before COVID, but the pandemic proved that fee for service alone couldn't handle the crisis. Organizations that already had invested in value based models were better prepared to manage patients remotely, coordinate care, and control all the costs. Another milestone worth mentioning is the mental health and workforce conversation. We saw unprecedented levels of burnout among clinicians, nurses, and public health workers. Many left the field entirely, The system had to respond. And one way it did was through new funding and wellness initiatives built into both Medicare and Medicaid reimbursement frameworks. The idea is simple: actual care for the actual caregivers. It's not perfect, but it's a start. Now, beyond policy, let's look at how the main players, the providers, payers, and the patients have adapted. For providers, technology has become part of daily life. Electronic health records have matured. Interoperability rules, you know, mean systems actually talk to each other more than they used to. Clinicians can pull patient data across hospitals and states far easier than before. But it's also added layers of complexity. More data to manage, more privacy concerns, and more tech fatigue. For payers, the shift has been toward integration and prevention. Insurers are investing heavily in predictive analytics, in digital tools that keep patients engaged between visits. And some payers now partner directly with telehealth platforms or even build their own. And that's not just about saving money, it's about staying relevant in a market where consumers expect real time access. And then there are the patients. This, to me, might be the biggest change of all. Patients are no longer passive recipients of care, they are consumers, and they know it. They compare doctors the way they compare hotels. They read reviews, they check costs, they expect transparency, and they have become advocates of their own data, their own care choices, their own digital access. It's easy to underestimate how powerful that shift is, because when patients change, the whole system has to follow. Let's not sugarcoat it though, there are still major challenges left. We still have huge disparities in access and outcomes, especially in the rural areas and marginalized communities. Even with telehealth, broadband access is still a barrier for millions. Health equity has become one of the top priorities for federal policy, not just as a moral issue, but as a financial one. Because inequity is expensive. It drives hospital readmissions, unmanaged care, chronic diseases, and poor outcomes. Then, there's the workforce issue, nursing shortages, burnout, administrative burden. These aren't just temporary problems, they are structural. And solving them will take more than better scheduling. It'll take redesigning the entire workflows and aligning initiatives so that clinicians can focus on care, not just paperwork or administrative stuff. And of course, cost. The US still spends more per person on healthcare than any other developed nation. Yet we don't always see the best outcomes. That's the paradox at the heart of the system. And the reason so much policy effort is now focused on integration, accountability, and prevention. And let's circle back to technology again for a second, because that story is still unfolding. Artificial intelligence isn't just helping radiologists read images faster, it's actually helping public health officials predict outbreaks, helping payers detect fraud, and helping hospital staffs work more efficiently. But with that comes concerns of ethical AI, algorithmic bias, data privacy. The next few years will be about finding the right balance, using AI as a partner, not as a replacement. And if we step back for a moment, what we are seeing is a healthcare system that's learning, sometimes the hard way, how to be agile. The pandemic taught us that flexibility can save lives. Regulations that once took years to update now change in months. Partnerships that seemed unlikely between tech companies, health systems, and government agencies are now quite common. That's progress, but it's fragile. So So question is, where do we grow from here? What does the next 5 years look like for US healthcare? On my personal note, I believe we'll see four major trends. I First will be home-based care. It might explode. Remote patient monitoring, hospital at-home programs, and continuous virtual check-ins can become normal. Medicare's pilot programs in this space are already showing results, strong results, better outcomes, lower costs, and happy patients. Second, data integration will finally reach critical mass. Interoperability rules are forcing the industry to open its silos. Health data will follow the patient, not the institution. That alone could transform coordination, safety, and cost efficiency. Third, I believe personalized care will move mainstream. With genomics, lifestyle data, and wearables, care plans will become far more tailored. It's the intersection of precision medicine and preventive care, and payers will need to adjust quickly to support it. And fourth, policy will focus on sustainability. That means stabilizing the workforce, addressing equity, and continuing to shift payment models towards outcomes. In other words, not just reacting to crises, but building resilience into the system. Now, let's be honest, right? The future won't be easy. We'll still argue about reimbursement, privacy, and regulation. We will still wrestle with costs. But the difference now is that the conversation has shifted from if healthcare should change to how fast it can change without breaking. And that's encouraging. If you're listening to this and you're a healthcare professional, a policymaker, or a business leader, here's the takeaway. This is the time to lean in. The next decade of healthcare will belong to those who can bridge clinical expertise with innovation, who can understand both patient outcomes and system design. If you're a patient or a caregiver, your voice matters more than ever. Ask questions, expect transparency, use your digital tools. The system only improves when the people it serves stay engaged. So, as we close this first episode of the Health Boardroom, I want you to leave with this thought. Healthcare isn't just evolving, it's maturing. We have moved from reaction to reflection, from emergency fixes to long term designs. And if we can keep that mindset, we have every reason to believe that the next chapter of US healthcare will be smarter, more humane, and more sustainable than the last. At last, thanks for joining me today on the Health Boardroom. If you found this conversation valuable, share it with a colleague or a friend who cares about where healthcare is headed. And don't forget to subscribe, because next time we'll dig deeper into how technology is reshaping the patient experience and what healthcare leaders can learn from industries like retail and aviation. Until then, stay thoughtful, stay inspired, and keep pushing for a healthier system. I'm Ron, and this is the Health Boardroom.